You need courageous people who pursue the goals, believing it is all extremely worthwhile, and who surround themselves with highly skilled and equally passionate people. Henri Termeer. Why am I here? Well, I'll tell you why I'm here. So, in Boston, my wife used to work for a company called Genzyme. It was historically, essentially the founder of biotech for, I guess she calls them orphan diseases. It's basically diseases that very few people get and that are fatal, and mostly to children. This gentleman here, statue, whom I'm humbled to stand beside, Henri Termeer, was the CEO of Genzyme early on. An absolute, innovator is a light term for this man. He basically founded the entire biotech industry that before wasn't concerned with treating drugs that weren't going to sell to a billion people. It's 1 out of 1 million gets a disease. No drug company wanted to essentially worry about that because, that market was too small to make money at. There were some things that changed in the government that made it that it could be profitable, and this was the first man essentially to jump on to that train. So for Gaucher's disease, it's the big one I remember because that was the start of most of it. They made huge strides in MS, but Gaucher's was something that was, not nobody was producing really anything for it because there wasn't enough money in it. This man decided that it was a medical necessity and decided that if patients were going to live because of what he did, if patients' lives were going to be improved because of what he did, then it was worthwhile to do and we'd figure out a way to make money at it. My wife's early tenure at this company inspired me to be an innovator. And I really, I owe it all to this man here. I'm not in the same industry. I'm not biotech. I'm rehab therapeutic and using, as many of you know, robotics and innovative treatment methods to find new ways to help more doctors help more patients. The enthusiasm and energy that my wife had towards everything this man started, that made me want to innovate. It made me want to do things bigger, not just in my own practice, but for doctors everywhere to be able to help patients that were falling through the cracks. And now we find, in this period of time here, more and more patients falling through the cracks. And a great friend of mine called it actually a chasm, Dr. Zalanka. He called it a chasm that patients are falling through because that's what we're finding. Patients that are in chronic pain aren't getting help. They get told to go home. They given anti-inflammatories, told to take off and, bother us with more serious problems. Well, these problems are serious. These are things that destroy people's lives, destroy people's families. 5th leading cause of death in Canada is medically assisted suicide. Why? And there are so many chronic pain patients on that list. This is a serious thing. And this is what made me want to innovate. So we took a trip to Boston where the statue is. One of the reasons was to have a look at this statue and actually, be able to be in the presence of this statue because of what this man started and what it meant to biotech and, the part of the medical industry that does amazing things for people that most of the medical industry doesn't consider a problem. Well, this is what my initiative is for chronic pain patients. This is what my initiative is with building the robotic laser-enhanced decompression system, with all the other devices we have in the pipeline, different ways for doctors to treat different things. And it's not for everybody. Not every doctor is in biotech. Not every research scientist is working on biotech stuff. Not every chiropractor or doctor that has, the ability to use our devices. It's not for every doctor. It's not a real easy thing to do. Speaking of not real easy, holding your arm up a while is not easy either. So I'm going to take a different perspective here. But this is tough stuff. It's not easy to work with these patients. we touched last week a little bit on the fact that, neuropathy patients are the most difficult to work with. But if you want to do something big, you got to ask for difficult, and you got to hope for and work towards a solution. Well, that first little quote that I went by, surrounding yourself with great people that have the same passion. These are the type of doctors that we want involved with our robotic decompression, our spine specialist light table, which is light therapy and decompression, that is coming out real soon. It's our shockwave initiative, all this stuff. This is stuff to get at patients that, not everybody cares about, unfortunately, because some people want it easier, just want to do easy things. I want to solve the hard stuff. So this man here, I just want to say thank you. And Henri Termeer, I know this is just a statue, but I want to shake the hand that started my inspiration of creating innovative things for doctors, so doctors can treat patients in more innovative ways, just like this man did for biotech. That's my initiative in the rehab industry. So if you're the type of doctor that rings a bell with, you want to innovate, you want to change, this man started an entire brand new initiative in pharma that's helped millions, if not billions of people. You talk about not just the patients, but their families and everyone they touch. It's given people life, it's given people hope. This is it's not the same quantum, not the same size, but it's what I want to do in the rehab industry. This is my inspiration. So thank you for watching. It gives you a little bit of history and a little bit of reason, a little further insight into why I do what I do and why I want to help doctors do what I do, because this is a movement. This is something that's going to help millions and millions of patients and their families. And if you're the type of doctor that likes the sound of that, you got to get on board with us. There's lots of ways to do it. We can talk about that another time. So thank you again, Henri Termeer, for your inspiration. And what can I say? I'm humbled to be in the presence of this statue in Henri Termeer Square here in Boston. Thanks for watching.